My name is Lori Buckley, and I will be your host. And first of all, I'd like to thank all of our wonderful volunteers and donators to Project Paint, because without all of our generous donations, we would not be able to provide all of our programming free to the cancer survivors in Nebraska and Iowa. And we really appreciate our donors. I'm very excited about tonight for a couple of reasons, because one, we're thinking out of the box. You know, lots of times on our cancer journey and our survivorship, we get so focused on the medical appointments that we forget about wellness. And there's so many wonderful things and tools out there that you can do that will help you without having to take a medication, and one of those is chiropractic care. And so tonight we have with us Dr. Katie Briley, and she is going to share with us her expertise on chiropractic care. She graduated from UNO in 2007, and then from the Cleveland College of Chiropractic in 2012. And she has been working at Performance Chiropractic since that time. And she does a whole host of things other than just manipulating the spine. She uses the Graston technique, Kinesio taping, nutrition, rehab, exercise, the active release technique, dry needling, a huge list of things that we are going to let her talk about. So we're very excited to have her here, and it's exciting to have something to offer you other than just a medication or a pill. So let's think holistic and see what Dr. Katie has to share with us. Go ahead.
Thank you for having me. I am going to just discuss a little bit about each technique that I do, starting with the adjustment and then the soft tissue techniques that I do. I am not a breast cancer, I don't specialize in breast cancer patients, but I do specialize in musculoskeletal pain. So I know a lot of the treatments that breast cancer patients go through can create a lot of scar tissue, adhesions to the tissue, and that's where I come in. So first and foremost, I do, the main thing we do is in a chiropractic adjustment. That is a manipulation of the spine. The spine and brain are the control centers of our body, and when things are not moving correctly in the spine, don't have the proper range of motion, feel stuck, that is when an adjustment is applied. That frees up those restrictions, gets blood flowing better, gets you feeling better. The best way I can explain an adjustment and kind of creating a release and movement for patients is we have two types of nervous systems. We have a sympathetic nervous system. We have a parasympathetic nervous system. If we are in the sympathetic state, which is a stressful state, if we're stuck, if we're stressed out, and our spine is not moving correctly, we can't think right, we can't function right, we're kind of in this fight or flight mode, okay? That's when we apply an adjustment, that sends that body into that parasympathetic state. So you're kind of in that relax and digest state of mind, and your body's able to release endorphins, serotonin, and just get you moving and feeling better. So that's kind of the best way to explain a chiropractic adjustment or manipulation. The other main technique I do in my office is called active release technique, or ART. This is a technique that's specialized in soft tissue movement and getting movement better in the muscles, the joints, the ligaments, and the nerves. I brought a trigger point chart with me, which a lot of, I kind of chose this page because I will see a lot of breast cancer patients that have a lot of neck and shoulder issues from mastectomies or radiation, whatever it may be, and they'll develop a lot of tension in these trigger points or even in their pectoral muscles. ART, what we do is we find these adhesions or these trigger points with our hands. Our hands kind of tell us a story about the tissue. So we find these knots or adhesions in the body, and we use specific motion and movement from the patient and tension from the doctor to relieve these adhesions and release these adhesions or trigger points in the body. I do have, I will demonstrate this later so that you guys can see what it is and how gentle of a technique it is and how the patient might feel.
This is really huge for those of you who have had the surgeries, even if it's just a lumpectomy or the mastectomy, because of the poor posturing and you're protecting and guarding that. So almost everyone who has had those surgeries actually could benefit from that particular technique. So if you're thinking, is that me or not? Probably yes. Any of that tightness you get there or in the back of your neck, this particular technique would be wonderful for that.
Yeah, it's huge, and you'd be surprised at how much relief you would get with ART. All the other techniques I do fall along the same lines of treating the soft tissue. It's just in different ways. So active release technique is my hand specific. So I use my hands to find those adhesions, find that scar tissue, and just kind of manually stretch and move the tissue. When patients, it depends on the patient, acute, chronic, obviously I will take all of that into consideration, but sometimes there will be tougher spots that I can't get with my hands. And we use a technique called Graston technique or instrument assisted soft tissue manipulation, where I would use this tool. Sometimes my patients will call this my medieval tool, but I promise you it's beneficial. And we use this along the tissue. This helps to break up more of fascial adhesions, and I'll explain what that is. Our bodies, we have skin, and then we have a fibrous tissue called fascia, and then right below that is where our muscles are. Sometimes that fascia builds up that scar tissue, and I have to break through that first to get to the muscle adhesions. So this helps me break through those fascial adhesions. What else was I was going to say with that?
So a lot of that would be for the ladies that are having limited end range of motion
Absolutely.
techniques. This is what would be a wonderful thing for you for that.
Yep. And then I was going to say something else with that. I think scar tissue and adhesions is kind of an unfamiliar term for people sometimes. So the way I like to explain that is we, in our muscles or in our fascia, we can develop little injuries to our tissue, and then over time it will build up scar tissue. So our tissue and our muscles should move and glide really, really smooth like this, and I should feel movement and full range of motion, right? We obviously know that we get injured and we lose that range of motion, and what happens is that tissue then sticks to each other. Like in our back muscle, we actually have 6 layers of muscle tissue. So we have like our traps, then we have muscles that are, deeper and deeper and deeper. And some of those muscles get kind of hooked on each other and then they don't move right. And then that's over time is how you develop pain. So that tissue in that specific area will lose blood flow, it will lose oxygen to that tissue, and that's where that's kind of what this does. It kind of revitalizes that blood flow and that oxygen to that tissue. So whether it be my ART or Graston, they're kind of the same thing, just a different way to use it.
Different way. And this one gets it deeper.
Yeah. Yep.
Because of that.
Yep.
Yeah. Awesome.
So, the other technique I use is dry needling. And needling can be a little bit scary, but if you're familiar with acupuncture, it's similar tool, different technique. Same idea though, as far as what I do, breaking up trigger points and adhesions. I use dry needling more for really stubborn trigger points that will refer pain, like this little trigger point chart. I'll get these people that will have these tough trigger points that will refer pain almost down their arm, down their back, or even cause headaches. And if it's a true trigger point, it's stubborn, I can't get it with Graston or active release, dry needling can usually get that. But again, the same idea. It all is to break up that hypoxic tissue, that tissue that lacks oxygen and blood flow, and kind of create that movement again. The last thing I do, and this is kind of, not the last thing, but one of the other things I use to treat for patients is I use Kinesio tape. And this is just kind of a nice aid to treatment. So if I have worked on an upper trap for somebody and we really got that tissue moving again, a lot of times I will create inflammation while treating people. This tape kind of holds everything in place. It helps with just kind of inflammation and again blood flow, but you can still have your full range of motion. It's just a supportive tape, so it's a nice aid to treatment for people.
Sometimes a combination of these techniques, what's really great about them is that you could have trigger points in an area that you did not have your surgery on, and it's just because you are using poor posturing and compensation protecting. We've talked about those kind of things before. And so the trigger point is really like, when you go to feel something, it's that hard little round spot that sometimes people are like, oh, I got this lump here. I wonder if something spread over here. If it's just that one little pinpoint thing in the middle of the muscle, that's your trigger point, and she can relieve that with the dry needling or any of these other techniques too.
Yep.
Yeah.
Yep.
So that's what's fun about it.
Yeah.
So many different things.
Yep. I have, well, do you want me, let me have you come over.
So here's our second reason why we're really excited to have Dr. Katie with us tonight is because she happens to be the daughter of our all-time favorite Project Pink volunteer. And Michelle is a cancer survivor. Come on, Michelle, don't be shy. Michelle is a cancer survivor, and she has volunteered and worked the front desk for Project Pink for many, many years. And she is that friendly voice that you hear when you call in on a Tuesday and Thursday. And if you haven't ever met Michelle, she is an earth angel to everyone she meets, and Project Pink couldn't survive without her. And
Lord,
so we're
Lord.
super excited that she gets to be here and have the proud moment of being here with her daughter. So go ahead.
Okay. So I am going to just demonstrate a little bit. I know my mom has a lot of tension in her neck and shoulders here. So I'm going to demonstrate what active release should look like and feel like. It's a gentle technique, but what I'll do is I'm going to take my thumb and pressure to her upper trap here, and then I will direct my patients what to do. So there is active motion involved. So I'm going to put some light pressure on you here, Mom. And then I usually direct the patient to look downward. So, yep, to their comfort level. I always tell patients this should feel like a good hurt and a good stretch. And then I have to work along that muscle. So it'll take a few repetitive stretches here. So, yep. How's that feel, Mom?
Feels good.
And I will get the question quite a bit, like, how is this different than massage? And that's a really good question. The best thing I can say is that this is, we're using active motion with this. A little bit of active motion and then different tension. Massage is usually just you're stationary and then they're rubbing out the knots. This is actively, and it's more specific, right? I know exactly what muscle I'm working on and trying to work out with each motion. So this right now, I'm just kind of working on her, a little bit of her upper trap and her neck muscles. So sometimes I'll add in, when I'm working into the shoulder blade, I'll add an active motion with the arm. Mom, I'm gonna have you touch your knee right there.
Okay.
And then look down.
Okay.
Yeah, so this is the levator. So these are all those upper back, shoulder muscles that can seem to get really tight with being a breast cancer survivor and going through treatment. So I like to do this one a lot on my patients. I will also work even lower. Mom, scooch forward on this table here. And I'm working on your others, yeah.
Okay.
So a really, really good one is this pectoral muscle, especially for patients who have had reconstructive surgery or lumpectomies. Obviously, we'll take each patient into account. So if you've had lymph nodes removed, pressure will change from me. But what I'll do is I'll try and just open the patient up and just pull back like this, nice and light, and just working that pec major, pec minor, those tight muscles that kind of are in the chest. So I feel good.
Mm-hmm.
Yeah. So that's an example of the active release, kind of for the upper back. I will show you, I'm not going to actually do this on her, but I will show you how I would do it. So I will incorporate a little active motion with this, but if I felt that I couldn't get movement in some of those muscles, this is where I want to kind of work some of the fascia out. So I would just rub this tool along the skin. There's usually lotion here, but I would rub this along the trap, the upper back, shoulder. I can even do the pec to work out that fascial adhesion. And then if I were to work this, I might have her just tilt this way a little bit more. And again, I do this to patient tolerance. So, oh, the tool? Yep. Yes, this is the Graston tool. So I would be using this for those fascial adhesions, and just a different way to break up scar tissue and tight muscles. Let's see here. I'm not going to needle my mom, but if I were to find a trigger point in her upper trap, levator, I would position her in a way that I would use these little needles. They're like acupuncture needles. I don't know if you are all familiar with that, but the technique that we use is clean technique. So I would clean the tissue with alcohol. I would position her so that she would be relaxed, and then I would apply the needle to that trigger point. Sometimes, depending on the patient, I will use a little microcurrent to the needle so that once the needle is in place, that microcurrent will make the needle pulse and kind of floss the tissue kind of through the needle to break up more of that scar tissue or adhesions. So those are kind of the three main things that I would do actively with the patient in the office, other than adjustments, for soft tissue treatment.
Treating the soft tissue is really huge because of reducing the pain.
Yes.
Can you explain a little bit about how that pain affects the central nervous system, and then how that hinders just healing in general?
Yeah, so our pain, like when we have pain receptors in our body, and that's going to send a signal to your brain, right? And what was your question again? Just
how important it is to treat the soft tissue, how that takes the stress out of your body and continues to let your body heal better.
Right. So when you have pain, there's kind of a disconnect, right, between it's sending signals to your brain that you're constantly in pain, you're constantly like have a stress, your body's releasing cortisol, etc. So when we get in and work out that soft tissue, we're able to release endorphins, we're able to release serotonin. That helps communicate better to your brain, and just function better. Mm-hmm. I think that answered your question there.
Yeah, because when you're in pain, you tense up even more.
Mm-hmm.
Yeah.
And so it helps when you can kind of release that.
Yeah.
Because anytime, any part of the body that's in stress, it keeps the body from healing, because it's focused on the stress. The healing process of your body takes place when your body's relaxed.
Right.
And so that's why all of those techniques are really, really important.
Right. And in the beginning, I mentioned like our parasympathetic and our sympathetic nervous systems. Mm-hmm. When we can stimulate that sympathetic nervous system and your body is functioning and moving at its best that it can be, you're going to feel better. Yeah, you're not going to feel as stressed. You're not going to feel that pain because we're able to get your body to function and communicate better.
Ladies, if you have any questions about anything, feel free to go ahead and send in your questions at any time. Do you have...
I have active stretches. I know that some of you had asked about some stretches. So I just printed off a few stretches that we can do actively together, or I can show you. It was just general that I picked. I mostly picked for just this upper. I think a lot of my patients that have had breast cancer, it's always up here. It's head and neck and shoulder. So I will show you these. Let's do some of these seated. So I like, specifically for the pectoral muscles, one is just sitting yourself upright, shoulders tucked down and in your back pocket is how I describe that. So not here, but here, and then arms open.